Today understand about a very interesting dissociative disorder called dissociative fugue. Formerly called as psychogenic fugue, dissociative fugue is a psychological state in which a person loses awareness of their identity or other important autobiographical information. This subtype of dissociative amnesia often includes some form of unexpected travel. People who experience a dissociative fugue may suddenly find themselves in a place, such as on a beach or at work, with no memory of traveling there. Similarly, they may find themselves somewhere in their home, such as a closet or in the corner of a room, with no memory of getting there. The DSM-5 refers to the dissociative fugue as a state of bewildered wandering. In addition to confusion about identity, people experiencing a dissociative fugue state may also develop a new identity. Dissociative fugue is a rare condition with prevalence estimates as low as 0.2% in the general population. Dissociative fugue states are more common in adults than in children, and symptoms usually appear in a person's 20s and 30s. Dissociative fugue is more commonly found in people who experience dissociative identity disorder. Dissociation is generally thought of as a defense against trauma that helps people disconnect from extreme psychological distress. A dissociative fugue state is a condition in which a person may be mentally and physically escaping an environment that is threatening or otherwise intolerable. The travel that may occur in a dissociative fugue state can last for as little as few hours or a few weeks or sometimes even months. In some cases, dissociative fugue can be very difficult to distinguish from sleepwalking. When the fugue state is over, people usually cannot remember what happened during the period of fugue. The fugue state can end suddenly or more gradually. Symptoms include persisting confusion about identity, persisting confusion about the past, and refusing to be challenged about their beliefs, especially who they are. Dissociative fugue is a subtype of dissociative amnesia. In these two types of dissociation, a person can lose awareness of their own identity or personal history or other autobiographical information. They even may take up a new identity. The person with dissociative fugue may find himself wandering physically to other locations, oftentimes in far off destinations. Fugue can last longer than dissociative amnesia, even up to a month, many months. Let us understand a case study of dissociative fugue. Bobby, 35 years old, was a middle manager at the sales department of a private firm. For the last few months, he was being consistently unable to reach the target and was receiving unpleasant feedback from his boss and subordinates also. At home, he was having marital problems. One day, he did not come back from work. His wife waited for him till midnight and then informed the police. After about 7 days, he was found wandering in a small town far off from the city. He was having an altercation with the local people near a tea shop where he had stopped for a cup of tea. He identified himself as Naveen and affirmed that he was looking for a job. However, he could not produce any identification or could not say anything about his past. The local people had been suspicious, held him back, and informed the police. When the police found Naveen, alias Bobby, he could not remember his own identity or how he had reached this place. He was wearing the same dress he had on 7 days back. However, his orientation to the time and date was intact. This was a case study of dissociative fugue. Now we can understand the severity of this condition. What are the symptoms of dissociative fugue? Let's understand that. The symptoms of dissociative fugue are uncertainty about a person's identity, looking unsure about their past, feeling defied if questioned about their identity, discomfort or anger, stages of grief, feelings of depression or loss, and even feelings of embarrassment. But why is psychological fugue or dissociative fugue caused? What are the causes of dissociative fugue? The onset of dissociative fugue state is usually sudden and follows a traumatic or a highly stressful event. Dissociative fugues are associated with difficult events such as natural disasters and wars, as well as severe marital or financial distress, alcohol abuse, depression, and a history of child abuse. There may also be genetic link because individuals with dissociative disorders sometimes have family members with the same conditions. How to treat this disorder? There is no specific treatment for dissociative fugue, partly because the condition is very rare. The process of recovery may begin when people experiencing dissociative fugue become spontaneously aware of the situation, or when they are unable to appropriately respond to questions about their background during an episode of dissociative fugue. Effective treatment practices include removing a person from the threats or stressful situations that may have contributed to the development of dissociative fugue state. An empathic, supportive approach to psychotherapy will help people who have experienced dissociative fugue feel safe and open to treatment. The treatment process may include developing healthy coping skills that help people manage stress and psychological pain more effectively. Other forms of therapy, like cognitive behavioral therapy and dialectical behavior therapy, may also be employed. There are no medicines for dissociative fugue. However, a mental health professional may need to address any co occurring conditions, like, for example, patients with anxiety or depression may benefit from medications that target those conditions. And if they are experiencing a dissociative fugue as well, it may help him in that condition as well. Thank you so much for listening.